So today I'm going to be talking about the integumentary system. The first thing I'm going to talk about is inside the skin. The skin is a highly elastic organ covering the entire outer surface of the body. It performs numerous functions essential to survival, including prevention of fluid loss from body tissues, protection against environmental toxins and microorganisms, reception of heat, cold, and pain sensations, regulation of normal body temperature, and maintenance of calcium levels. So the skin consists of 3 layers: the epidermis, the dermis, and the subcutaneous or hypodermis. The epidermis is the thin uppermost layer, consists of basal cells, melanocytes, which are responsible for skin color, keratin-producing cells for hair, nails, and outer protective skin surfaces, and Langerhans cells important to immune protection. The dermis is a dense metal layer, contains the skin's structural components, nerves, blood vessels, sweat glands, hair follicles, sebaceous glands, and collagen. The subcutaneous or hypodermis is the underlying layer of fat cells, cushions body tissue from trauma, insulates against cold, and stores fuel reserves. So with this model, I'm going to be showing you where the epidermis, dermis, and subcutaneous or hypodermis layer is. The epidermis is this uppermost layer you see up here. The dermis would be from here to here, and the subcutaneous or hypodermis would be here down. And in the hypodermis or subcutaneous layer, there's also connective fibrous tissue, which would be this here, and muscle, which would be this down here. Okay, so next I'm going to be talking about warts and moles. Warts are hard, benign lumps on the surface of the skin, usually with a rough raised surface and round or oval growth. Warts are produced when a virus enters the uppermost layer of skin, causing an overgrowth of skin cells. Most common in children, they can spread through direct skin contact and typically appear on the face, hands, or feet. Most commonly or often as seen as plantar warts. Warts usually cause no discomfort and disappear within 2 years. However, treatments including medications, cryotherapy, and electrocautery may be used to remove warts more quickly. As for moles are skin lesions commonly in light-skinned people that are often small and round and usually benign. Moles contain melanin, which gives them a brown or tan color. This is the difference between wart and mole. You can see the melanin, melanocyte, overgrowth of cells, the stratum corneum, granulosum, spinosum, and basal. Next, I'm going to be speaking about the nail anatomy. Like the hair, nails are an accessory structure of the skin. They contain plates of densely packed keratinized epidermal cells, which arise from superficial cells in the nail matrix, located under the skin behind the nail root. Above the nail root is the visible portion of the nail called the nail body. The free edge of the nail extends from the nail body beyond the end of the finger or toe. Near the nail root is a cuticle or lunula shaped like a half moon. Here you can see the nail anatomy. You can see the nail body, lunula, eponychium, nail roots, the epidermis, dermis, proximal nail fold, hyponychium, and the phalanx. So next I'm going to speak about how we sweat. The skin contains 2 types of glands that produce perspiration. Exocrine gland, which are distributed throughout the body, open into sweat pores on the surface of the skin. In response to increased body temperature, sweat is produced in the deep, coiled portion of the exocrine gland, then passes through the duct to the epidermis. It consists of water, salt, and other chemicals, and evaporates on the skin surface. Helping to cool the body, the more specialized apocrine sweat glands are concentrated in the armpit and genital area and produce a thicker, oily secretion, often in response to emotional stress, cold sweats. Here you can see the sweat duct, the opening of the sweat duct, the sweat, and heat. So next I'm going to talk about how wounds heal. After a wound occurs, the damaged portion of the skin begins to heal through a series of complex overlapping stages. In the first stage, a blood clot forms to stop bleeding and in most cases dries to form a protective scab. Below the surface, inflammation takes place as nearby blood vessels enlarge and deliver oxygen and nutrient-rich blood and leukocytes to cleanse the site of dead tissue and bacteria. Rapid proliferation, regeneration, and migration of new epithelial cells help to replace the damaged area with new granulation, tissue, and close the wound. A scar is formed when the edges of the injured tissue grow together during healing. The 4 stages of wound healing. Number 1 is a wound with a cut blood vessel. Number 2 is a blood clot, constricted blood vessel. Number 3 is a scab. Granulation tissue is fibroblast, lymphocyte, and macrophage. Number 4 is when the scab falls off, regenerated epidermal tissue. So next I'm going to be talking about skin cancer. Skin cancer is a malignant growth on the skin caused by the uncontrolled growth of epidermal cells. Skin cancer is associated with known risk factors, including sun exposure and sunburn, family history of skin cancer, light or pale complexion, and age. Lesions may be small, shiny, waxy, crusty, or rough, asymmetrical in texture, or have an irregular border. Cancers are often larger than 6 millimeters in size and can range in color from white to blue, brown, or black. All unusual or suspicious skin lesions should be examined by a physician. Here you can see the cancer cells, the stratum basal, and the stratum corneum. And here below you can see the ABCD of skin cancer. If it's symmetrical, even edges, one color, or less than a 1/4 inch, it is not cancer. Now if it's asymmetrical, uneven edges, 2 or more colors, or more than a 1/4 inch, you should get it checked out by a physician. Next, I'm going to be speaking about skin and acne. Acne vulgaris is a common condition caused by inflammation in the sebaceous glands and hair follicles. Blemishes including comedones, blackheads and whiteheads, pustules, pimples, and nodules or cysts can appear on the face, neck, or upper body. Usually beginning in adolescence, acne can last from 5 to 10 years. In some cases, acne may continue into adulthood or occur for the first time in adults. How acne develops. Hormones trigger an increase in the production of sebum, an oily substance important to skin lubrication in the sebaceous glands. Excess sebum and dead skin cells become trapped in tiny hair follicles located near or within the sebaceous glands. Bacteria from the skin enters the clogged follicles and multiply, causing inflammation, pus, and swelling, visible as comedones or pimples. In some cases, pustules may progress to nodules or cysts that extend deeper into the skin and causing scarring. Next, I'm going to talk about psoriasis. What is psoriasis, you may ask? The chronic skin condition known as psoriasis occurs when areas of the skin begin to undergo an abnormally fast rate of growth. Excess skin cells accumulate on the surface of the skin, forming red raised patches with silvery flaking scales. Psoriasis can develop anywhere on the body but often begins on the scalp, knees, and elbows or back. The most common form is called plaque psoriasis. The exact cause of the psoriasis is unknown, but is believed to be an immune-related disorder and may be hereditary. Symptoms may disappear or improve with exposure to sunlight or phototherapy. Types of psoriatic skin lesions are plaque, a raised flat-topped lesion, a papule, a small, less than 1/4 inch raised lesion, a pustule, a raised lesion containing pus, excoriation, erosion of skin caused by itching, exfoliation, loss of skin in layers or scales, guttate, multiple small teardrop-shaped lesions, lichenification, thickening of the skin, scale, excess dead skin cells accumulating as silvery white flake-like debris on the skin surface. Here you can see the difference of psoriasis versus normal skin cells. There you can see the epidermis and the dermis. And here you can see the stratum corneum, spinosum, basal, and papillary layer. Next, I'm going to talk about pressure ulcers. Pressure ulcers, also called bed sores, are localized injuries to the skin and underlying tissue that can develop in people who are bedridden or have to stay in one position for long periods of time. Pressure ulcers usually result from skin and tissue being pressed between bone and another surface, such as a chair or a mattress. Over time, the compression can cause restricted blood flow to the skin, producing damage to the tissue. Other factors that may be involved are shear and friction as from sliding down in a chair or bed. Stage 1 of pressure ulcers is the ulcer first appears as a reddened or darkened area in lightly pigmented skin, red, purple, or blue in darker skin. That persists after pressure is relieved or removed. Stage 2, there is a partial skin loss that involves the epidermis and possibly the dermis. Usually the ulcer is superficial, presenting as a blister, abrasion, or shallow crater. Stage 3, the ulcer is through the full thickness of the skin. Damage extends down but not through the underlying fascia, presenting as a deep crater. Some yellow tissue may be seen. Stage 4, there is full thickness skin loss with extensive damage and tissue necrosis. There may be damage to muscle, bone, and supporting structures. Lastly, I would like to talk about burns. Burns are injuries to the skin that damage or destroy the skin's protective covering and functions. They can cause by heat, contact with hot objects, scalding, or flames. Ultraviolet light, sun or artificial tanning, chemicals, electricity, or even frostbite. First-degree burns are limited to the epidermis. Symptoms include heat, pain, and reddening with minimal blistering or scarring. Second-degree burns may be superficial or deep, but usually extend below the epidermis into the dermis, affecting the sweat glands and hair follicles. Characterized by swelling, severe pain and blistering, red and moist skin. Third-degree burns extend from the dermis to the subcutaneous layer or underlying muscle. Charred, leathery skin may range in color from red to white or brown with no blisters. Here you can see the difference between first-degree burn, second-degree burn, and third-degree burn. So the skin consists of 3 cells. Types of... Next, I'm going to talk about pressure, no discomfort, and appear within 2 years. Oh, I meant disappear.